try to figure out. So I won't show the prior study, but patient has history of question. Data. Sorry. So patient has history of biliary strictures, and they're following up on the biliary strictures. And this, again, this is orthotopic transplant. I won't show you the strictures, but the strictures were there. So as I was reading the study, I noticed this. I noticed that the celiac is markedly narrowed, right? As I was following the artery, you can see that it's kind of like narrowed, then maybe a little bit dilated, then sort of we lose it maybe because of the artifacts. Distally, the branches are pacified. So, I was prepared to actually dictated it, as a celiac stenosis, and as a result, there would be a problem with an outflow, inflow into the hepatic artery. So as I was reviewing the images, this is one of the delayed images, and if you notice here, the celiac is as big as they come, so without any narrowing, right? So what do you guys think?
Could it be like a median arcuate ligament? So they're at a different phase of breathing between the arterial and the delayed?
Right, so this is exactly what it is. So we use Philips, and Philips by default images everything on end expiration. So this is somehow here the patient didn't do end expiration, so we actually caught her like in a more inspiratory phase. So you can see that the compression of the celiac is relieved. So I do have an angio to follow it, you can, which I may or may not be able to show you on this. There. So you can see there's the hooked appearance with narrowing, and then this was the expiration, and then on the inspiration, you can see that. Oh no, sorry, this is the inspiration. You can see that. I'm sorry, this is the expiration. You can see that the narrowing is much more prominent. So they confirmed that the patient has median arcuate ligament, but one thing they noticed that I missed on MR is that there's a small SMA aneurysm, and if you go back and look at the MR, we actually can see it. So it's there, if it ever loads. So while it's loading, let me just show you the stuff. So actually, the median arcuate ligament syndrome after liver transplantation can cause quite a bit of problems. It can, again, as patient breathes, there's compression of celiac artery, which worsens during expiration, and so that it can create the poor inflow into the hepatic artery. Usually, the problem is apparent immediately at the surgery. So if the surgeon notices that they often will either do the division of the ligament, or they use alternative revascularization with using the bypass graft or aorta, whatever graft. And the most common complication is the thrombosis of the transplant artery. And it's actually not uncommon. It's about 12% of liver transplant has some sort of, at least some degree of median ligament argument. And then in general, this condition is associated with increased blood flow into SMA, and these patients do have higher incidence of SMA and pancreatic or duodenal artery aneurysms. So let's see if the images showed up. Nope, can't. I don't know. It just broke. It just broke it. So
I have a question, Victoria.
go for it.
Uh, is the medial arcuate ligament syndrome more commonly recognized in the post-transplanted patients for some reason? And if so, why?
So we do quite a bit of transplants, and I've never seen one that actually caused a problem. I did a little literature review, and it seems that the, at least the series that I found in Europe, they actually screen patients prior to surgery with duplex sono, and then if the patients have any suspicion of median arcuate ligament, they release the ligament during surgery to prevent any issues. And when I spoke to our transplant surgeons, it seems like the approach varies by like where you practice. So our surgeon used to practice in Canada, and they routinely, if there was any issues with arterial inflow, they would immediately release the ligament to see if the inflow improves. And then here, like she said, they just kind of go straight for the bypass without wondering. So I think that the patient is asymptomatic in sense of that there's no abdominal pain associated with this, but I guess the degree of compression was enough to compromise inflow into the hepatic artery, and because of that, now she developed a bunch of biliary strictures, and she's actually going for revision of the arterial inflow this week, I think. And here's the aneurysm that I missed there.
Great case.
Cool. Yeah, I bet you
Right.
it's not necessarily more common in transplant patients, just that the artery is like you'll look for it more carefully because
Right.
they'll have arterial consequences.
Right. I think that's it. That they just don't.
They don't want to take any chances. So they're very concerned about the inflow, and in the asymptomatic median arcuate syndrome patients, which is probably the majority, it's not a concern, but in this class of patients, the inflow is more critical.
Right.